mental health challenges, especially for children and adolescents, are real and are growing. Some are as a result of the drugs that are out there, drugs that our children have access to, but others are not, and majority probably are not. Therefore, we need to make sure that those who need help get the care they deserve, and that services like the ones offered here at the hospital are actually available to our children. Mental health issues in black communities in particular are a bit or have been taboo. It has always been that when you have a mental health issue, that's a white man's disease. And you can't be depressed. What is depression? Where do you come from with depression? Are you that educated that you now can have depression? You know, those are the questions that I actually asked. When, yeah, but you are fine. And you know, you also become stigmatized. Where you have mental issues, you then become stigmatized. But the biggest problem is the attitude in our communities that says mental health issues are diseases or are issues for educated people. We say that easy for zifundiswa. One of the priority projects or programs that I said this year we will focus on is mental health. Because like you correctly said, there is not a single person who does not have a challenge in one form or the other. And as long as we continue to stigmatize mental health, we will never be able to solve the problems that we are faced with. There are people who need to be honestly open about the challenges that they face, but because there's stigma, we are unable to go to our communities, we are unable to go to our families. As a result, children themselves are unable to go to their parents to say, I have this or that challenge, because you will be said you have a problem and you'll be stigmatized. Our society needs to get used to the fact that mental health is not a challenge. We just need to be able to address it. And I'm not saying it's not a challenge because our children are not facing it, but it's not a challenge in a sense that you should not keep quiet about it. It's not a challenge in a sense that you should not be stigmatized just because you have a mental health issue.